Now we're going to start talking about internal condoms. Internal condoms are a protective barrier that insert into the anus or the vagina to provide STI protection or protection against unwanted pregnancy. So just like with external condoms, the first thing that we're gonna do with internal condoms is make sure that the packaging is still good, because a barrier method loses all effectiveness if it's punctured or torn. So we really wanna make sure before we even use a protective barrier method that it's in good shape. So I'm gonna look at the outside of the packaging. I don't see any tears, any punctures. And then the next thing I'm gonna do is make sure that the condom is still good by looking at the expiration date. FC2 condoms are the only internal condoms on the market, and their expiration dates are located in the fold of the wrapper. So I'm just gonna look, yep, my condom is still in good shape, and now I'm ready to open it. So just again, like external condoms, I'm not gonna use anything sharp to open this packaging. No scissors, teeth, fingernails, anything like that. And lucky for me, there's a nice little perforated edge right there. So once I tear it open, what I will pull out is something that looks exactly like this. It's just kind of looks like an oversized external condom, except for it has a firm inner ring inside. For anal sex, we're gonna remove that inner ring, but for vaginal sex, we're gonna keep it in there. And so first, I'm gonna demonstrate how to use this for vaginal sex, and then we'll switch gears and look at how to use it for anal sex. For vaginal sex, I'm going to kind of adjust this inner ring almost like you would a menstrual cup. Some people call them diva cups. So they start out like this, and you've got to kind of squeeze them into a little pocket to be able to insert it into the vaginal canal. And I'm gonna do basically the same thing for this firm internal ring. I'm just going to pinch it, and so it turns into a little bit of a figure 8. And now it's in the right shape to be able to fit inside of the vaginal canal. So I'll take out my vagina demonstrator, and I'm gonna use this to show you how to insert it. So the first thing I'm gonna do is keep it in this figure 8, and I'm going to put it into the vaginal canal. Now the vaginal canal is a pretty firm canal that actually fits around the inner ring. So it will hold it in place. You don't have to worry about it popping up. So I can put it in and then readjust. I'm gonna take out my clean finger, and I'm just gonna really gently start to push it into the vaginal canal. Now remember, if I feel any pain, discomfort, I'm gonna stop what I'm doing. I'll find a new position, but I don't want this to be painful or uncomfortable in any way. So I'm gonna really gently start to push it in to the vaginal canal, and then suddenly I'm gonna feel it kind of open. It's no longer gonna be in that figure 8 shape, and now it's gonna be open, and what it's opening around is just like a diva cup. It opens and fits around the cervix, and that's what makes the barrier from the fluid. So it's gonna open up and it's gonna fit around my cervix. Once it's there, I'm not really gonna feel it. It should never be painful. You might be a little aware of it, but it shouldn't be uncomfortable in any way. It should just kind of be up there. And now you're ready for sex. Now, an important thing with internal condoms that you don't really have to worry about external condoms because they fit really snugly around the toy or the penis is that with internal condoms, it is possible to actually miss the barrier when you're starting to penetrate. So whether you're using a toy or your partner's penis, you wanna really make sure that you don't accidentally kind of get excited and go around. You wanna make sure that you're actually going inside of that internal condom. Once you're done having sex or playing with your toy, you'll just kind of give it a little bit of a twist to make sure that the fluid inside stays inside of the internal condom, and then really, really gently just pull it out just like you would a tampon string, right? Once it's out, you'll put it in a knot, you'll tie a little knot in it, and then throw it in the trash can. Do not flush this down the toilet. It is not environmentally friendly, just like external condoms, but with internal condoms, they absolutely will clog your toilet, so you definitely don't want to flush this down the toilet. So now let's switch gears a little bit and talk about how to use internal condoms for anal sex. So I'm gonna bring out a slightly different demonstrator. And the first step for using this for anal sex is to remove the inner ring. And look how easy it is to fall out. It's not connected in any way, it just falls right out. You can just toss it off to the side. You're not gonna need it for anal sex. Now that you have your internal condom and it doesn't have a ring in it, you're ready to insert it into the anus for sex or to use a sex toy. So to do that, you've got a couple of options. You can either use a sex toy or your partner's penis to insert it. And to do that, you're gonna kind of put this internal condom on like you would an external condom. Kind of just drape it over the shaft of the penis or the toy. And then gently, with lots of lubrication, because remember, anus anuses don't self-lubricate. So when we're having anal sex, we want to make sure that we're using a lot of good lubrication so we don't cause any tearing to the anus or we don't break or tear the condom. So once we're really nicely lubed up, we can use our partner's penis or a sex toy to gently glide the toy into the anus. You'll notice I can't quite demonstrate this all the way, but once it's fully in, you'll hold the condom at the base and then gently remove your penis, and now the the internal condom is nice and gently placed into the anus and ready to use for penetrated sex. Remember, just like with vaginal sex, it's easy to kind of accidentally go around the lip of the internal condom, so you want to make sure that you're getting inside of it during penetrative or any kind of penetrative play. Now, there's a second way that you can insert this into the anus. We don't need a sex toy or a penis to do that. We can just use our fingers. So a clean hand, I don't want any body fluids on it, because remember, my partner is going to be going into this, so I don't want any of my body fluids inside of this internal condom. I'm going to really gently drape over the condom over either my fingers or my partner's fingers, whatever I choose, and use these fingers to gently glide the condom into my anus or my partner's anus. Again, I'm going to hold it at the base and gently pull the condom out. Now you'll notice I'm using an unlubricated demonstrator, and without lubrication that condom kind of comes out with my fingers, but with lubrication it would stay firmly in place. My fingers would really gently pull out, and then I would have a really nice internal condom placed and ready for play. When we're done, I'm just going to twist that condom to make sure that anything inside, any body fluids inside of the condom stay in place. Gently pull it out and then toss it in the trash. Again, not flushing it down the toilet. So that's how you use internal condoms. And before we end, I just want to quickly note that with any safer sex supply, whether it be dental dams, internal condoms, external condoms, what's most important is that they're comfortable and that they don't cause any pain. So if internal condoms or external condoms are giving you some issues, switch it up, try something different, see if a different method works better for you.